My name is Christopher McAndrew. I'm a registered nurse. This is my assessment video for Nursing 323, Thomas Jefferson University. Assisting me today is my wife, Justine. Good morning, Mrs. McAndrew. How are you today?
Good morning. I'm good, thank you.
And what brings you in today?
I'm here for my physical assessment.
Okay. I'm going to just do a top to bottom physical assessment on you, if that's all right?
That would be great.
Okay. I'm going to start with your head, if that's okay.
Okay.
All right. If you can look straight ahead, if you can follow my finger. Patient follows 9 cardinal gazes in both eyes. If you look straight ahead. Pupillary reflex is normal in both eyes, 2 centimeter perla and accommodation is present. Gross inspection of the skin reveals small broken blood vessels on the right side of the nose. The skin is generally warm to the touch, dry. Skin turgor is elastic. I'm going to whisper something in your ear. I just need you to repeat it.
Okay. Hi, how are you?
Patient responds to a whispered voice and is able to hear. Now I'm going to look in your mouth. I'm going to check your tonsils, if that's okay.
Okay.
Can you open your mouth? Tonsils are 0 bilaterally. Now I'm going to palpate some of your lymph nodes. Is that all right?
Sure.
Okay. There's no lymphadenopathy in any of the auricular, preauricular, submandibular, occipital, jugulo-digastric, superficial, or cervical deep lymph nodes. Next, I'm going to listen for any bruise or thrill in the carotid artery. No bruit or thrill noted with the bell of the diaphragm. Neck is midline. Any pain?
No.
No pain on palpation. So now what I want you to do is I want you to turn your head like you're shaking yes or no. Now try to turn against me. And shrug your shoulders. Now I want you to move your arms at the shoulder, both sides. Okay, you can do the other side now. Now your elbows. Up and down like this, like you're lifting weights. And then the other side. Now move your wrists. Okay, full range of motion in upper extremities. You can stop now. What I need you to do next, if you could stand up. Can you take off your top? Because I have to look at your skin and scoliosis test. Okay. Gross inspection of the skin of her posterior reveals multiple nevi and some larger lesions. If you could bend over and touch your toes. Palpation of the spinous process reveals no arthritic changes and no pain. Spinal curvature appears normal. Since she's in this position, what I'll do is I'll auscultate the lungs in the posterior, use on the 9 positions, using the diaphragm. Take a deep breath for me. And again. There's vesicular lung sounds in all bronchial fields. Now if you could just turn around. All the way. Now I'll sculpt both lung sounds and heart sounds on the anterior. No, because I have to look at your chest expansion and everything like that. Okay? Take a deep breath. And again. And again. Lift your right arm up. Take a deep breath. Take a deep breath, please. Okay. Vesicular lung sounds in all fields with the diaphragm of the stethoscope. Now I'm going to listen to your heart sounds.
Do I still have to stand?
No, you can sit down. So I'm going to listen for the aortic valve on the right sternal border, pulmonary valve on the left sternal border. I'm going to sculpt for any murmurs on Erb's point, tricuspid valve, and mitral valve. All valves are sculpted normally, no murmurs are sculpted. My stethoscope has a built-in bell and diaphragm, so I was able to sculpt both points at the same time. If you could lay down for me, please.
On my back.
On your back.
Can I put my shirt back on?
I'm going to palpate. I'm going to now palpate the 4 abdominal quadrants. Any pain?
No.
Now I'll listen for any type of bruit or thrill. Borborygma is noted, but no bruit or thrill.
I can't see anything.
Valve sounds present in all 4 fields. If you could sit up, please. Patient has symmetrical chest expansion. I'm now going to palpate your abdominal lymph nodes, or your inguinal lymph nodes.
Sounds great.
So, you palpate on the inner aspect of the groin. There's no adenopathy noted. Now, if you could do me a favor, if you could extend your knee and flex your knee on both sides. Now, if you could take your left foot and run your heel down your shin on your right foot. And do the same on the other side. Okay. Now I'm going to assess for a Babinski reflex.
Can I
If you
put my
could take off your sock.
shirt back on? Can I put my shirt back on? Tell me.
Yeah, put your shirt back on. Now let me see your foot.
Tickles. Okay.
I can't assess a Babinski because she has a very bad tickle reflex. I'm going to assess light sensation. Close your eyes, please. Close your eyes, please. How's that feel?
Light.
Soft?
Soft.
Close your eyes, please.
Oh, scratchy.
How many things are touching your hand?
2.
Okay. She has stereognosis now.
What do I have?
You can feel 2 points on your skin.
Okay.
And palpating the feet, there's no pedal edema. There's a palpable popliteal pulse on both sides. No popliteal adenopathy noted. Dorsalis pedis pulse present on the right side as well as posterior tibial. Dorsalis pedis and posttibial present on the left side. Let me see your radial pulse. Radial pulse present on both the right and left side. Brachial pulse present on both the right and left side. Okay, what I need you to do is squeeze my fingers as hard as you can. Grip strength equal bilaterally. If you could push up on my hands with your feet. And again. Now push down on my feet like you're trying to drive a car. No, not like you're driving a bicycle. Look, push down like you're pushing the pedal of a car. Like that. Now resist my pull.
Gentle.
Resist my pull.
Oh.
There you go. Femoral pulse is present on both sides. Carotid pulse is present on both sides. Now I'm just going to touch your face, okay?
Sure.
Maxillary and frontal sinuses have no crepitus or pain. There's no edema noted. And then last thing I need you to do is lay on your side.
You have to ask somebody what you're doing.
I'm palpating your apical pulse now,
Really?
and then I'm gonna percuss where your kidneys should be.
Right.
Kidneys percuss normally. If you could roll on your other side. Kidneys percuss normally bilaterally. That completes my head-to-toe assessment of Justine McAndrew. Thank you very much.